Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Welcome. I'm Abby, your Healthy Living NP. Welcome, ATH Alish. How are you guys doing today? Hope all is well. We're going to be talking about understanding your test results. So please share the show. Please share the show. Please share the show. Invite your friends so other people can listen as well. I'm just going to go in here for a second. Okay. So again, my name's Abby. I am a family nurse practitioner, so you already know that. Welcome and share the show. My disclaimer, as always, I am a provider, but I'm not your provider, so please do not make any changes to your regimen without checking with your own provider. Okay. So I thought about talking about test results because this is something I deal with on a daily basis because I order tests for different things. Okay. So we're going to be talking about understanding your test results. So let me go in here for a second. All right, so this is not comprehensive, so I'm not going to be saying everything else. I did my research. I already it's not research. I already know all this, but I had to put some things together to speak to a wider audience. Okay, so now you'll be saying, first of all, you're saying, why do we even need to get test results or get lab results? Blood work. Okay. So basically, you come to the office for your for maybe regular physical or your yearly physical for any reason why you come to the doctor's office and all. Okay, so when you do come to the office, yeah, we do your get your personal history, we get your personal medical history, your family history, medical history, any kind of surgeries you've had, your allergies. Sometimes we do social history too, like what kind of job you do, if you're married, not married, other things. All those things put together, kind of we come together and put it together so we can come form a diagnosis. Also, just to get a background too. So when we start developing your plan of care, we have all that information. Okay. So when we do all that, and depending on if you have any other issues and you tell us about it, okay, that's when we might send you for other testing. But for baseline testing, we have to do like your regular routine test that we do every year. Okay. So we're going to be checking for your, checking for infection, anemia, checking your blood sugar, your A1C, which is your diabetes medication, your thyroid, and all that. So we have to test for all that. Those are the things that like the routine tests. And based on that, and we send you for additional testing if we need to do that. Okay. So basically, we do those tests and all that to make sure to see how your major organs are functioning, like your kidneys, your heart, your liver, your spleen, everything else that works along that keep your body healthy. So we do that again. Those are the baseline tests that we do. Okay, so let me go in here. So sometimes we do run the test too. So depending on your doctor's office and all that, there are other ways that you can get your test results. Some laboratories like they send the test results directly to you the same day that they release it to us. Okay, so some people get their test results and then they go on Google and they start Googling and get themselves so worked up because they see something that may be out of the ordinary, out of the norm, and they think, oh my God, I'm probably dying or I probably have this or I have that. And that's when sometimes it can be a little hassle when the patient get it the same time we get it. Some other laboratory will probably send it like a couple of days after. And sometimes we also have a choice of saying, please do not release this test result to the family, to the patient yet, especially if it's something that's really detrimental and based on our assessment of the patient when the patient comes in too. So it's not like we're trying to hide anything from you. We want to discuss it face to face with you first. Okay. So, and there's nothing wrong with Googling your stuff. I had show where I said, the dangers of diagnosing yourself when you reading things online. So people go on WebMD and you hear like your symptoms and everything. Oh my God, I'm dying. So there's nothing wrong with doing that. But at the same time, I tell people you can go ahead and do that, but make sure you take that information and then talk it over with your provider. Or say, okay, I read here somewhere they said this over here. How does this relate to my results? How does it relate to me? Okay. And then remember, even if you're reading Google, even if you're reading another reputable site, they always tell you to make sure that this is the general information only. You're supposed to check with your own provider. So if that site doesn't say that, there's something wrong with that. Okay. So use that information. And then when you come into your doctor's office, you can discuss that. Alrighty. So basically, there are two kinds of tests. Okay. So let me just go in here. There are two kinds of tests. One test is the positive and negative test. Okay, so and then we also have the other one, which is relative values. But we'll do the positive and negative first. Okay, so I'm gonna put on my glasses. I'll be answering questions periodically, going through there. Okay, so alrighty, so let's go in here. So tests that give you a yes or no, the positive, negative, give you yes. It's usually for diagnostic purposes. So if we, let's say we're running for your COVID test or pregnancy test, usually it's like negative or positive. Okay, so you're either pregnant or you're not pregnant. If you're pregnant, we have to do additional testing and all that to see how far you are in the pregnancy test. Okay, so COVID is negative. And sometimes we do tell you if you test too early, also, but usually this is the kind of test. Okay, so basically, so positive and negative tests are typically used for diagnostic purposes to ascertain whether a disease or condition is present or not. Okay, so basically you say, when I have this thing, am I pregnant or am I not pregnant? Do I have COVID or do I have COVID? So those are the tests that we do. Okay, so positive means that whatever the test was looking for was found, and negative means that whatever they were looking for was not found. Alrighty. And then sometimes there's also false positive tests. Again, like I said, let's say if you were exposed to COVID maybe 2 days ago and you go in there and get tested, your test results could be okay, it could say negative or false negative, false positive. So we'll tell you that too. Yes, you've tested too early. So if you start having symptoms later on, make sure you come back and get tested again because you probably tested too early. Also, the same thing if you're exposed to maybe HIV or anything else and you got tested too early, that maybe you're like a false negative and we have to check. And also sometimes if depending on that, the results and also the other symptoms that you're having and everything else that's going on, we may want to check again. Okay, so usually when it's like false positive, or if we think there's anything while reading it, we can also test you again. Okay, so and the next one is, I'm not going to be too long today, guys. Relative value test. Okay, so these are the tests where we do that. So let me go in here. So a relative value test is one that measures specific components of your blood, urine, or any lab samples and compares those values to what would be expected in a normal, healthy population. So basically, if you came to me and I did your blood work and I say, well, these are your levels. Okay, this is where for healthy people, this is what is considered in the healthy population, what the range is of a test results. So let me go in here and I will just go into my stuff here. Give me a few seconds so I can go to my pictures. Mm, 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 mm. So So for let's say here for your cholesterol panel, this is lipid blood test. This is your cholesterol panel. Okay. So you see there where it says this is the range where I'm pointing to. So if I'm going over the test results with this person, I'll say this is where you are. This is what we measure, the measurement stuff. This is where your results are, and this is the range. So let's say your total cholesterol is supposed to be, anywhere between 100, 0 to 200. So and you're like maybe 155. So that way that means you're still within range. And I look at that, say, look at your good cholesterol. This is where you are. This is the range. This is where you are. Now, based on that, you might say, oh my goodness, is that bad? Is that good? You're within range. Now, if you're closer to where the range is supposed to be, that's when we start saying, okay, your numbers are a little bit off and we need to keep an eye on that. Like this, the test. Let's see this one. Okay, so this is your complete blood count. Okay, so we'll look this one to look for infection, and we'll look for anemia, like a low blood count, and also for making sure that you don't have anything else going on with your clotting. So if you cut yourself, your blood needs to stop after a certain time. So we said this is the range for people who are healthy, the healthy population. This is where they are. This is where you are. So we go over that. We say, okay, see that? Okay, that doesn't show any kind of infection going on. Basic infection now, not like if you have anything going on. And we move over there. We say, okay, this is your anemia panel here. Okay, this is all your anemia panel. This is what you're supposed to be looking at, and this is where you are. So I usually go in deep detail when I talk it over with my patients. I say this is where you are. Like I said, they'll look at the A1C for the diabetes, or like, again, going back to the cholesterol, and they usually, if it's abnormal, doesn't mean that okay, yeah, oh my God, something's going to happen. It's a sign that's saying, okay, this is where we are. Okay, based on your family history. Remember, I'm talking about going back to your family history, going back to your personal history, going back to your eating and all everything else that you do. Okay, so based on those numbers, you look like you're headed to where you may be needing medication. You look like you're heading to where you need to start eating healthy and exercising a little bit more. You're supposed to be doing that regardless. Okay, so making sure you're doing that. So and sometimes those numbers are a little bit above, and patients might say, "Well, I don't want to do that. I don't want to take any medication right now." So the numbers could be, if the numbers very elevated, especially within that range, and you fall so far higher than that range. Usually that's when it's okay. This is when you may need medication, even though you still have to eat healthy and you still have to exercise and all that. But based on your family history, maybe your mother had a stroke, maybe your brother had a stroke, maybe your cousin had. Your usually first degree relatives will go by first. Grandmother, your sibling, maybe somebody had a stroke, maybe somebody had a high blood pressure, or maybe you have high blood pressure and all that. So when you have high blood pressure, you don't feel anything until you start becoming symptomatic. So it's very important that's okay. Yeah, we may have to start you on medication. And some people might say, no, I don't want to be put on any medication. I want to get it checked again. And usually sometimes I would say, okay, let's check it again. But those numbers are high to where you may go home, you're walking, it's like you're literally walking on eggshells there, because if those numbers continue to go higher than that, and even where they are right now, you may be a high risk for having a stroke or a heart attack, or anything. You remember now also your kidney, you could be having some kidney disease too, because over time when your blood pressure remains high and all these numbers remain high and all that, your body cannot function effectively when those numbers remain high like that. So we discussed that over. So we're not saying, oh yeah, you just want to give me medicine, or you just want to try to find some kind of disease and put it on me when it's something that I don't have. I don't feel anything. Some diseases you have no symptoms until it's too late. Like I tell people sometimes, the first time of a heart attack is a heart attack. The first time of a stroke is a stroke. So you don't want to get to that point. So that's the reason why when you do go to your family doctor and they go over your history and also go over your medications and all, because sometimes some of these test results can also be used to like change your medication around, pull back on some medications, because if your numbers are getting better, they might decrease the medication you're taking, and eventually you may get off the medications completely. Some people, if you have type 2 diabetes and all that, then you can be on insulin, and depending on what your A1C was when they started first, and eventually you may not have to be on anything if you're eating healthy and those numbers keep going down. So it's important also sometimes, like I said, change medication because something may not be working, especially for your thyroid and you taking your medications. Sometimes we ask you to, when we come back, we see your thyroid results and say, are you taking the medications like you're supposed to be? Are you taking your medicine like, first thing in the morning, 1 hour away from every other medication? Are you taking it every day like you're supposed to be? Because sometimes it could be the patient doesn't know that they're supposed to be taking the medication one way, or taking it maybe in the evening, or with food or without food. All of that affects how the medication breaks down into your body. So it's important. So we're not just looking at those numbers. That's why it's important when you get your test results, you're not just looking online for it and saying, oh my God, this is where I am. You have to come in back for the doctor to explain all that to you, your provider, to explain all that to you, looking at the whole picture. We're taking care of the whole picture, the whole person. We're not just looking at the test results and saying, okay, this is where we are. So this is it. Okay, no, this is where I'm going on. No. So we're going to be asking more questions in there and explain it in detail. And if you do get your test results and all that, to make sure to explain it to you. Say, where are my numbers? I'm looking at, okay, where are my cholesterol? Where was I before? What was I last year? Where am I this year? Usually when we get the test results, it comes out to where we have results from before, okay, from maybe like a year or two before. So I look at them, I said, this is where you were, this is where you were last year, this is where you were the year before, and this is where you are now. Okay. So if you hadn't been treated all through, these numbers continue to go up. You're walking around. This is very dangerous. You cannot walk around with these numbers. Now, some people say, well, my other doctor didn't tell me that, and they just told me everything was fine. That's I cannot speak for anybody else. Right now, you're my patient, and I have to do what needs to be done to take care of it. You have every right to say, I don't want to do anything. I want to just continue. Okay, there's some test results where it doesn't matter, whether it has nothing to do with your diet, like your thyroid and all that has nothing to do with your diet. You have to get treated. The numbers are wrong because, again, I did the show on hypothyroidism, low thyroid, and high thyroid. The thyroid gland right here is the motherboard of your body. It controls all the function in your body. Okay, so if that's out of whack, you're going to start having some problems. So again, if we bring the test results to you and say, this is where you are, this is where regular people are supposed to be, okay, and this is your results. All right, so what do you want to do? And I sit there and I have this discussion with my patient. I don't just come in there and impose things on them, okay, because the patient is also part of the care plan. Right. So basically we do that. And again, like I said, we use it to, and sometimes we can use it to diagnose too, because usually if you're, let's say your hemoglobin, hematocrit, like I told you, the range there, let me go back here. Okay, so let's say if these numbers are really low, your hemoglobin is called H&H. Okay, if you're, let's say, a woman of childbearing age, a woman who's still seeing her period, if those numbers are very, very low, and you're telling me every month you see your period, you're bleeding pretty heavily, and those numbers, and if I see those numbers, and especially if it's very, very, very low, okay, you're going to the hospital because you need blood transfusion. If it's very, very high, also we're checking you, we're going to send you to go see the blood doctor, the hematologist, because we want to make sure nothing else is going on there already, that you're not having any kind of bleeding disorder, anything else that could be more serious than that. So based on those levels, okay, then we may need to do additional testing or send you to go see a specialist. We'll do everything we can do in primary care, and then we'll send you to see a specialist that anything that's outside of my scope of practice, because there are certain tests that specialists can prescribe, or any other thing that I cannot prescribe because that's outside my scope of practice. I know about it because they send it back to me and I have to go over it. But then you have to go see the specialist. And usually, sometimes I tell the patients, I want you to go see the specialist. I want you to go see that. And sometimes they don't go. Okay, please, if I tell you, or your provider tells you, please, would some, and we do, by the way, we do change medications around. We do test you again every 3 months. If it calls for to be tested every 3 months or to be tested every 6 months, we do that. There's some testing, also some results that come back that if I see it and is very, and is, I mean, so abnormal, I'm sending you to go to the emergency room. Or I may say, okay, we'll test it again in next week, we'll test it in 2 weeks, and go on from there, especially if you be becoming symptomatic. There's no reason why somebody who's bleeding heavily, especially like a woman who's still seeing her period and she's bleeding, she's becoming very fatigued, very tired, losing energy and missing from work and school. You're going to be following up with the OBGYN also. But, usually that's like the baseline that we start off with. Okay. And if we need to do additional testing, we may have to do like an ultrasound to make sure nothing else is going on there. Even for a man, we look at your kidney numbers, we look at your prostate numbers, and we may need to send you to somebody. So, okay. So your yes or no test that tells you negative, positive, that tells you what it is that I'm looking for. We rule it in, meaning, okay, yes, we're looking for this, and this is what it is. Okay, so we ruled it in. That's your diagnosis. If we're looking for something else and we ruled it out, it was negative, then we move on from there. And sometimes we have to do many more additional testing in order to come to a diagnosis, because sometimes what we're looking for is not there, but you're still having the symptoms. So you hear people who say, yeah, I went to this doctor, I went to this one, and they've done so many testing, and they still haven't found out what's going on there, because most of my tests still coming back normal. Okay, so even, and especially for autoimmune disease, like when the body attacks itself, it takes a longer while to find out about autoimmune diseases. So you may have to go to several doctors in order to get your final results. All right, so it doesn't mean that this doctor doesn't know what they're doing, or just, it just, sometimes it requires a lot more testing to get to their results. Okay, so your negative and positive, and your relative value test. So make sure when you go to your doctor's office and say, "Yo, doc," and so, your cholesterol level's doing good today, and you can say, "Oh, so what is it? So what was I last time? With my good cholesterol, my LDL? It's supposed to, that's the worst part of the cholesterol panel. What's my LDL? What is it supposed to be? Okay, so make sure you ask certain questions and all that too, because if they tell you everything is good today, you want to know what it was last time, you want to know what it is this time around. And it's important that you do go to your primary care doctor and get your routine testing done, your annual testing done every year, because if you're in your 20s and 30s, we're looking at that when you're in your 20s and 30s. So when you get to maybe 30s and 40s, or even before then, something shows up, we can say, okay, we have something else to compare it to. All right. So, and also for a test like your TB test too, there are other it's still the same thing, but like your TB test. All right. So this is the skin test, the PPD. We usually do that for a job, and also I think they do that for immigration and all that. So based on that, most places don't do that anymore, because they have the ruler that they can put it there, and based on how long it is from here to there, and they can say whether you do have TB or not. But because of that, and the fact that it's been sometimes it can be subjective, and also because depending on, even though the person is trained as reading it, it can also be subjective, and it has come on some other scrutiny too. So because of that, based on that, If we see that and there's anything we need to go to, we send you to have a chest x-ray, because usually if you have anything like TB, we're doing a chest x-ray to see if there's anything going on in your lungs. But most places now, they're doing the TB Gold test, where it's like blood test too, where that's more definitive. So when that comes back and it's negative, you're good to go. If it says positive, even with that, we still send you for a chest x-ray, just to have double confirmation that there is something going on. And then that way, we also, based on your medical history also, and sometimes where you live, some certain countries that have whatever factors that may lead more people to having certain kind of infectious disease, we may go a little deeper into that. But even in America, like somebody who's been in IV drug abuse, some people who are homeless, people who live in shelters, and the kind of lifestyle that you live, it puts you at a higher risk. Doesn't mean that other people are not at high risk, but it puts you at a higher risk. So we may have to do additional testing. Okay. So that was a TB test, and we follow up with the chest x-ray. Okay, so some of the questions that you want to ask your provider. Okay, let me just go in here and see. Go back to my banners. Okay, so what are some of the questions you should ask? If you're just joining me, let me just go in here for a second. If you just joining, we're talking about understanding your test results. Let me see if there's any topic here. Oh, this is needed. Thank you, Abby. Thank you, Dennis. Thanks for watching. So we will go in here. If you have any other questions, people, please ask, and you can always ask later. I'm available. Okay, so what are some of the questions you should ask again? So you can ask your doctor, and don't be afraid to ask that. Okay, make sure you can, if you need to ask it, please explain this to me. I don't understand it, and the relationship you have with your provider, with your doctor. So tell them you come in, because some places will tell you to come in to get the test results explained to you. Okay, so you're going to be asking what is normal, and are your test results normal, like I already said. So again, they'll tell you, yes, this is normal. Like I would tell people, this is high normal, meaning that you're right in the margin of becoming, your test results becoming abnormal. Okay, this is low normal, this is high normal. So we have to go through that and go with that. Okay, so you want to ask the question, say, oh yeah, my doc said my cholesterol level is fine. Well, what if you like really right at the margin there? Okay, and then am I supposed to be still taking the same medication and all that? So if it's normal, do I still need to take this medication? Just because it's normal doesn't mean you need to stop taking your medication. Remember, we're looking at the whole patient. Okay, so the other risk factors are you may need to take the same medication, or they need to reduce it. Okay, so ask that question, because most people don't like to be on medications if they don't have to be, and we don't like to put people on medication if we don't have to. I know people say that, but every time we put you on medication, that put the malpractice risk go up a little bit, because we have to be monitoring that. Okay, so if you don't have to be on a medication, we won't put you on any medication. But at the same time, we'll explain to you why we're not putting you on medication now, and we may have to put you on later, or we're starting it now, and this is the reason why we're going to be doing additional testing eventually. Okay. So again, the next question you want to ask, if your results are not normal, or the better results are lower, bigger, or smaller than the rest of the results of your other tests. So basically, like I said before, you want to ask, okay, where am I? Am I high normal? Am I lower? Am I lower than where I was last year? Am I getting better? I'm eating a little differently now. And also, it's also important, when one of the things I needed to say, that if you do have family members, during the time you see your family doctor, okay, and something happened to a family member, a first degree relative, again, your mother, your father, your siblings, and you say, oh, during this time, my brother had this happen to him, right away, ding, 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 ding. Okay, that puts you in a different category. So we start looking a little bit more. Not that we're not going to look for the other people, but like I always says, high risk and higher risk. Okay, so we start saying right away, oh yeah, my brother had a heart attack. Oh, my brother had this, or this person had that, or I was exposed to something. So right away, when we look at those numbers, we start painting a picture where we're going to find a diagnosis and then develop a plan of care. Okay, so again, like I said, we'll tell you, look at your cholesterol level. We'll say, oh, it's still high, but you know what? It's trending down. The numbers are trending down. So that's good. You're taking your medicine like you're supposed to, right? You're eating healthy, right? You're doing things, you're watching your stress level, you're doing not eating healthy and sleeping, getting enough sleep and all of that. That helps. Remember, it's the whole body, mind, body, and soul. Okay. So again, like you can say, are you compliant with your medications? Because we ask that every time. What I want you guys to do also, especially if you're a little older, have the list of medications in your phone. Okay, just have it like in a secret app or wherever you can reach for it. And also, if it means for you to bring all your medications in, because I've noticed also people will have all the list of medications there, and then some of the medications they're not taking it. When I tell them to bring the physical bottles in for us to go over it, if they do medication reconciliation, which is what we're supposed to do at every visit, then I find out, wait a second, you have this on this list, but you're not taking this and you're not taking that. Now look at your test results. Maybe that's the reason why this is coming out this way. Okay. So it's important that you go into the doctor's office for, for like, especially for your annual visit, take all your medications, even if it's not prescribed by that particular doctor, take all your medications and all that so we can do a medication reconciliation and have your most current list on you. So put it somewhere where you can go back and change it. If they change the dosage and all that, go back and do that. Make sure you keep it as updated as possible. Okay. If you have a family member or somebody that you take care of, make sure you always have the most updated list, because sometimes you go into the hospital too, the list that's there is the list that they were discharged maybe 2 years ago that's there. So it's important that you know that and know the medication that you're taking. I am taking aspirin 81 milligrams 1 time a day. I am taking hydrochlorothiazide 25 milligrams 1 time a day or 2 times a day. Make sure you know completely. If you're taking eye drops, don't forget eye drops. People forget the eye drops too, because it could be for glaucoma, it could be for other reasons. So all those medications kind of interact with each other. Sometimes we cannot prescribe certain medications because you're taking this medication. Okay, so it's very important. So don't think like eye drops. That's also very important too. Asthma medications, that's also very important. All right. And the other question you can ask also is, you could ask other questions. I'm just saying, what does your healthcare provider recommend you to do to bring them into a normal range? Let's say if it's high. Again, like I said, we're going to be talking about eating healthy again and eating more healthy, because some people might say, well, I'm eating healthy now. Okay, let's discuss what it is that you're eating. Are you eating late at night? Are you eating, maybe you work 3 to 11, or maybe you come home and after taking care of the kids and doing homework and everything, and you're eating around 10 to, 8 to 9 o'clock at night. Maybe you're some people who are just night eater. Okay, I may tell you, don't eat really, don't eat heavy foods, don't eat a big bowl of rice or pasta or, mashed potatoes and everything late at night, because what happens when you eat late at night or that late at night, chances are more than likely you're going to be going to bed, or you're going to be resting watching TV. Your body's not breaking down anything. Okay. So what it does, it just stays there. And eventually, like I taught about cholesterol being your system and all, you have your arteries. And then when the cholesterol, little plaques that form along there, let's say the blood is going through. Think about a water hose. The blood is going through it. Everything's going through there. But something starts getting there. And then before you know, you pour in water from the water hose and it looks like it's blocked in there. And sometimes you have to, I don't know the word, but you have to do something to make the water come through clearly, or you have to go in there and spike it up and clean it up, like in gutters and all. Okay, so think about a gutter. You have the water flowing through the way it's supposed to go, and then next thing you know, the debris all in there, it's not going to go. So think about that. That's your heart. That's your blood vessels that go into your heart, your brain, your kidneys, and all. So eventually, something's going to happen if you don't take good care of yourself. So we explain that. How are you exercising? Are you going for a walk? Are you going to the gym? Are you exercising home, or do you have your little dumbbells at home, or something, anything that you're doing to stay active at least 30 minutes a day. Okay, and then start building up on that, because you can be 30 minutes forever, but that's the least. And also if you can tolerate it. All right, so we'll to do that. And also, again, like I said, we may need to increase your medications if we have to, because sometimes you have to increase the medication, or maybe add additional medication, or change the medication because it may not be effective. Okay. And then sometimes also based on the results, like I said, we may send you to see a specialist, and sometimes we need to do additional testing too, because based on the results, we might say, okay, there's something showing up there that we need to look more into that. And that's when we have to do additional testing. And if we tell you repeat the blood work in 3 months, please repeat the blood work. Okay. Don't come back like a whole year later and say, oh my goodness. Oh my goodness. No, make sure you repeat the blood work, because we need to be able to compare it. Okay. And some people might ask, how accurate are the labs? How accurate is this test? They're very accurate, because they have to, all the laboratories have to meet federal guidelines. All right, so it's important. At the major ones, Quest Diagnostics and LabCorp, they all have to meet federal guidelines, because that's the license in the line. You can't sit there and do a test and say, oh, I'm just going to put in the results and all that, because it's people livelihood, their lives and livelihood they're dealing with too. Okay. So they have responsible people working there who read all these results and all, right? And they're trained. All right. So, and again, just because the result come back this time and then we do it again and come back a different one doesn't mean the last time it was wrong. It just means that, that it need to do additional, we'd have to test again, because sometimes your labs is basically at that time. Okay, because sometimes I tell patients, don't eat before going to get your labs. Nothing to eat or drink after 12 midnight. Some of them will eat and forget it, go and eat. Well, that's going to affect your glucose level because it has to be fasting. That's going to affect some of your cholesterol level depending on what you ate. Some people drink heavily a couple of days before going to, so all of that reflects in your results. So it's important that when your doctor sends you to get your results, you listen to the instructions. Okay, sometimes you forget and you're like, oh my god, I forgot and I ate this morning. Don't have the test done then. I know it's inconveniencing because you have to go to work, you have to go to school, and you have other issues, but just don't have the test done because you want to have a more accurate sometimes. Because sometimes patient will tell me that, and I say, okay, well, guess what? We have to do, we have to do it again because you ate. Okay. And sometimes, oh my God, I forgot. I'm so sorry. I'm like, it's okay. Things happen. All right. So again, sometimes people may refuse to take their medications, and we go over and we explain. I tell them, I say, you don't, nobody's forcing you to take their medication, but this is what you're dealing with, and then we document, because you can't come back and say, oh yeah, you didn't tell me that, and we document. All right. So, and it's important also, when you have your labs drawn, have the doctor explain it to you. Okay. So making sure, depending, sometimes we because patient will complain that if they have to come in, they have to pay copay to come in. Why do I have to come in for you to explain this to me? And all, there's certain tests that we need to see you face to face. I'm not going to tell you that you have HIV over the phone. Maybe if you happen to travel and that's the only way, fine. I'm not going to tell you that, okay, you had this a chest x-ray done and it showed, even though you're looking for TB, and it shows something else that's there. Those are the kind of things that you need to be sitting in front of me for me to tell you that, because you don't want to walk out the door and find out, oh my God, I can't believe it. So I have lung cancer, or do I have this, or I have that? And just your mental well-being, you getting into the car, you're thinking of that, you're driving, you could put that puts you at risk or a family member at risk. And sometimes I may tell you, is it possible to bring somebody else, or you can have somebody on the phone? So when I'm talking, the other person is also listening to. All right. So that's one of the main important things that we need to bring you in. And sometimes, even if it's not that something serious, we want you to come in because we need to explain certain things. But you can also do telehealth too. You can call and say, but you also have to pay for telehealth. It's less because I'm not doing physical examination with you, but we can go on from there. And sometimes people come in and they have other issues that we discuss it too. All right. And like I said, some testing, we need to do some imaging, and depending on the doctors that we send you to, you would do. We can do like X-ray. My knee hurts. Okay, we'll do X-ray. We're not going to go straight to CAT scan. We're not going to go for certain things. You have to do CAT scan or ultrasound. We do the basic first, and then we go from there. MRI, you have to go see a specialist, because the insurance company, based on your insurance and all, they won't want to do all those tests are very expensive. So they want to make sure that you've done all these other tests prior to doing that. Of course, that depends on if you're in a hospital or other things, then they can go right ahead and do that. All right. You want to also if you call, sometimes I'll tell the staff, just call that patient, tell them the lab, everything was okay, and we'll just see them again the next visit, or we'll repeat the testing in a year. Okay, so usually they'll tell you that. You cannot ask the staff on the phone, which would be like the medical assistant. You cannot ask them what your test results were. Can they please explain it to you? Because that is outside the scope of practice. So they won't be explaining that to you. Then they will tell you you have to come in, or you have to schedule telehealth so the doctor can go over your results with you. So they won't be able to tell you that. Now, that's the policy where I work. I could be different somewhere, but that is outside the scope of practice, because it's not just reading numbers to you. It's also explaining everything that means and where to go on from there. Okay. So 1 second here. I'm just going to turn this off. And also, you want to also ask when you go get your test results at your primary care doctor's office. Also, if you go see other specialists, you want to ask them what the notification policies are, because there are some places where they'll tell you, if you don't hear from us, everything's okay. Or, it would take us maybe 3 to 4 days to call you back. And sometimes they may not call you back. I can tell you that it's very busy. It's very, very busy. And every time you get labs, like 100 other people are getting labs at the same time too, or repeat labs. So many things that we have to do that sometimes certain things may not deliberately get missed, but some things may be delayed, or I may see a result. And I don't think it's really important for me to call you that week. Meanwhile, you're sitting at home and you're like worried, like, oh my God, maybe something's wrong and they haven't called me, or maybe something's good, they haven't called me. So it's also, you can always call and say, oh, I'm just calling to find out my test results, and then we'll schedule a time for you to come in. Also, you can also, and some other places, like again, like I said, There's some doctor's office where they have like their disclaimer. When you sign that form, when you sign in the form to join to go to that practice, they tell you it's very strict. You are responsible for calling us to get your test results. If we, test results, anything, and what is you look it up on online or anywhere else, you are responsible for calling us. We're not going to be calling you because again, it's impossible to call everybody and to keep an eye on every test results that's supposed to come back. And sometimes some people come to the office and they don't get the test done for like 3 months, 6 months at a time. So when I sitting there looking at a computer every day, oh my goodness, did this person get the test done? Oh my goodness, did this person get the test done? Now sometimes too, if the lab is very critical, if the result is very critical, the laboratory will call us and say, keep it, look at it. They will send it directly to us and we have to call you right away. Okay. So that for that, basically we're going to be calling you. But it's important because we tell you go get your blood work. When you tell you go give some urine also, you will check in to see and your urine analysis, we're checking to make sure there's nothing going on with your kidneys. All right. Sometimes you have urinary tract infection too. So you want to call us back because if you came to me and told me you've been having burning sensation when you're peeing, or it makes it difficult when you're being intimate with your partner and all, and then you don't call back to find out what your results were, there's a window of time that we're going to order the antibiotics. So you want to call back in a timely manner. And of course, we'll be calling you too. But mostly you have to you have to be responsible for your own well being. Okay. So, like I said, you're a major partner in the plan of care. All right. We can't do anything without you and without your consent. But at the same time, you want to make sure you take charge of your own care. All right. So, again, ask for the notification policy and go on from there. Let me see if there's any other question. Mm, Let me see. Mike said, Miss Abby, thanks for the health tips and the educational information. Oh, thank you so much. And thank you always for your support. So basically, let's talk about labs, nothing too deep today, but it is deep because your lab results tells us, what it is that we're looking for, how to, manage your care, and with your consent and everything, that we can go on and develop your plan of care. So you may need to get your test, you may need to get your medication changed, you may need to get your medication the dosage decrease, you may need to get a change increase, you may need to be referred to another doctor. And sometimes you go to one specialist, and based on what they do, you may need to go to another specialist too. It's not all about talking about trying to get your money. It's trying to make sure you get the best of care. Okay. I'm not sitting here saying everything that we do is 100% perfect. All right. And you may not get a result, you may not get the answer that you're looking for. For sometimes it takes a couple of years to finally get to a diagnosis. Usually, most of the time, it's like something autoimmune or something, but not if you're having like kidney issues or your heart issues or your lung issues and all that too. Most of those things, they can easily be diagnosed based on different testing. Okay. So it's important. Make sure you follow up with your primary care doctor every year, getting your routine testing done. Also, when you go see your OBGYN, you're getting additional testing there. And if you need to follow with a kidney doctor, heart doctor, and they're right different testing, the endocrinologist that take care of your thyroid and your diabetes. So, and sometimes you want also, if you see another doctor like a rheumatologist too, the one who takes care of all your and allergists and all those different people, you want to make sure that if they're ordering testing every 3 months and this one ordering testing every 3 months, you can also just tell them and just say, can you please try to make it in a way, it's not always possible, but can you please try to make it in a way where everybody else will be doing the test at the same time, where it's kind of coinciding. So I'm not paying copay, especially if you're on a fixed income, and sometimes nobody wants to pay copay if you don't have to. So my doctor just prescribed that, my endocrinologist just prescribed all of this. So can you please, if you don't need to add this part, can you please do that and put them together? Okay, so it's important. And especially when you come from the hospital too, and you're doing your follow-up visit in your doctor's office, there's some tests that were already done, and we may need, after we review your records and all, we may need to order them additional 3 months, okay, or send you to see other doctors. So it's important there too. All right. So basically, your test results, yes, and it's negative. That means what we're looking for is not there. Positive, what we're looking for is there. Okay. And also the other one, knowing the ranges, ask your doc. Okay, you told me my cholesterol level was fine. Where is it in within the range? Where is I? Where am I today? Where am I last year? Do I still need to keep on taking the same medication? And also, again, most important, want to make sure you access the notification policy. And like I said, you can the LabCorp or Quest Diagnostics, they have their own account. They can release the records to you right away when you get the results. And also, your doctor's office too also has a portal account, so you can sign up for that. And some of them will tell you your lab results are ready. They won't give you the results, or some of it will be released directly to you too. Okay, so it's important, and make sure you get the instructions that if you're supposed to fast, how long you're supposed to fast before you get your lab work done. Alrighty. So if you like this show and it's been helpful to you, please give me a thumbs up. Alrighty. And also, I'm still trying to get to 1,000 members by July. So please, you know, invite your friends. Just go on your on there and just hit the button that says invite friends, and it can invite all your family members. Facebook will just invite all of them all at once. We'll just send an alert to all of them all at once, so you don't have to do it manually. Okay, so thank you all for watching. Alrighty, for those of you who are watching me tonight, I say thank you. For those of you who will be watching later, I say thank you, and thanks for your love and support over the years and always. You guys have a good night. You stay safe. Alrighty, and I don't see any additional questions there, so I'm going to sign off. Okay, so let me see. Yep, I think I got it all. Okay, so thank you very much, and good night, and I will see you guys on Tuesday. For those of you who are watching from other forums, again, I do put up daily videos every day or every other day or so. So please join Abby Tyler's Healthy Living for more healthy information between Tuesdays. I come on live on Tuesday, and then I put up other videos on during the week. All right. So thank you all for watching, and I will talk to you guys later. Take care now. Bye bye.